Hello dear friends, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010. Today we're talking about the breast lumps. What the woman should think about when she finds this lump. What can it be? The topic of this video is not malignant diseases, is not cancer, because most of the lumps, most of the breast nodules are benign. So what can it be? Let's figure it out. About half of all women will have some lump in her breast during her lifetime. So these are very common, and most of them are benign. Some of them may have increased risks of cancer, but most won't. Some of them may need some future investigations or even biopsy, but many don't. So, first of all, what are the risk factors of having something in the breast? Breast is a very hormonally sensitive organ. That's why any hormonal changes may lead to some changes in the breast. What do we know? The intake of hormonal contraceptives by women will actually decrease the risks of benign changes in the breast. And intake of hormonal replacement therapy in menopausal women, for example, for treating the symptoms of menopause or for treating osteoporosis, they may actually increase the risks of different changes in breasts. Also, family history of breast cancer or other changes may also lead to increased risks of changes in the breast. And physical activity, I mean aerobic exercises, when the body consumes a lot of oxygen, uses this oxygen to produce energy, all the cells are full of energy, they are feeling well, and this is a good thing. It's good for prevention of any overgrowth, any tumors, and also cancers, according to metabolic theory or mitochondrial theory of cancer development. And we know the chronic hypoxia, meaning low oxygen, may lead to different tumors, even malignant tumors. But this is a topic of separate videos. So aerobic exercises, moderate exercises are very good as a preventive measure. So all benign nodules in the breast can be classified into three big groups. First, non-proliferative, meaning no overgrowth of cells. And these are the most, I would say, the most non-suspicious lesions for us, not dangerous. Second group are proliferative already, when there is some cellular overgrowth, but without atypia, meaning that all the cells look normal. And the third group is proliferative, but with atypical cells, meaning these cells look not totally normal, a little bit ugly, and we are more suspicious about them already. Let's talk about the first group at the beginning, non-proliferative lesions of the breast. Most common, of course, are breast cysts. I was talking in details about breast cysts in the other video. Please watch in the description below this video. In general, cysts are quite round sacs filled with fluid. They occur due to the duct clogging, and in majority of cases these are just simple cysts. You don't need to do anything with them unless they grow very fast, cause a lot of pain, or you have any suspicions. Anyway, you need to do ultrasound and see the features of these cysts. Again, watch the detailed video in the description below. Galactocele is something like a cyst, but it's filled with milk, breast milk. And this is the topic of breastfeeding women. It's totally benign and doesn't need any excision. Sometimes it may need puncture to remove milk from there. There can be also other causes like apocrine papillary hyperplasia or mild hyperplasia of usual type that are not precancerous and not dangerous. Second big group are proliferative lesions, meaning there is some cellular proliferation, like overgrowth. They can be, for example, usual proliferation of cells in the ducts. No treatment is needed, it's not dangerous. The risks of cancer in future is elevated minimally. No hormonal prevention is also needed. The other thing is intraductal papilloma. It's like papilloma on the skin, for example, but inside the ducts in the breast. Sometimes you can feel it by the hand, it can be the nodule there. Often you can see the bloody nipple discharge or some discomfort. It needs to be biopsied with a special device, with the needle, to exclude any atypical cells. You need to remove it if you find any atypical or ugly, not normal cells. And usually the doctor will discuss the need for special hormonal therapy as a prevention measure. If there are no atypical cells, sometimes we may just observe these patients, but still, according to some investigations, the risks of cancer in future may be from 5 to 20%, quite high. That's why if these are solitary, maybe it's better to remove them, especially when they are already too big. You can feel them already with your fingers. If they produce any nipple discharge, bloody nipple discharge, or if they produce some discomfort. And sometimes there are many of these papillomas or diffuse papillomatosis. This already may increase the risks of cancer if there is no atypia after biopsy, no ugly cells. 3 times higher risk of breast cancer in future. And if there is atypia, then 7 times higher. That means quite serious. Of course, this needs to be removed surgically. There is also sclerosing adenosis. It's like also nodule, but with the sclerotic component prevalent, meaning like scar tissue. It may be quite frightening and ugly and hard, palpable mass. And this increases the risks of breast cancer 2 times. But in general, it doesn't need to be removed, or no need for some more frequent investigations or any hormonal intake. Sometimes you can see radial scars. They look like a sun or maybe spider with central scar, and their ray and like beams are going into all directions. This thing in general is not dangerous, but it's better to remove it so we don't miss any tumor hiding behind. And afterwards you don't need any hormonal treatment. And next is fibroadenoma. Fibroadenomas are benign tumors of the breast that are most common. They are 50% of all the lumps women find in breasts. They are very hormonally sensitive. They may increase or decrease in size during their cycle, or increase during pregnancy, decrease after menopause. They can be painful or painless. Usually they have well-defined borders, they are easily movable, and if they have characteristic features on ultrasound or mammography, and if they are proven by biopsy, then you don't need to worry too much about them. They don't really increase risks of cancer. They don't need to be necessarily removed. Only if they grow too fast, if they cause pain, or if they occur after the age of 40, then it's better to remove them. Also, sometimes there are complex fibroadenomas. When they're mixed with other types that I was talking about, they may actually increase sometimes the risks of cancer. Better to remove them also. Also, there is a available option, cryoablation, meaning we destroy this fibroadenoma by freezing. I was talking about it when in the separate video about treating cancer without surgery. And as you understand, not only cancer may be treated with such methods, but also, for example, breast tumors, benign breast tumors. There are also adenomas where there is not much fibrous component. For example, in breastfeeding women, you can sometimes see them. They are totally benign, they are not dangerous. There are also tubular adenomas, a rare type in teenagers. They should be removed and examined by the microscope. In general, they are not dangerous also. Pseudoangiomatous stromal hyperplasia are a very difficult term. It resembles the tumor from blood vessels. If you do biopsy and you prove this diagnosis, You don't need to worry about it too much also. No need to excise it. And the last one are proliferative lesions with atypia, meaning there are some atypical, not normally looking cells. It can happen in ducts or in breast lobules. Anyway, this is already more dangerous and this must be removed. There is also a separate group of lesions that are not connected to breast tissue, like for example lipoma. This is the benign tumor of fat, totally not dangerous. Also there is, for example, fat necrosis after trauma to breast. Some of the fat tissue of breast will die and make this kind of lump, not dangerous also. There is also diabetic mastopathy that is occurs in diabetes patients, type 1 diabetes, autoimmune disease. And this is autoimmune attack to breast. You can see there are a lot of lymphocytes inside this area of the breast. Also, it's not dangerous. There are also hamartomas. This is the mixture of glandular, fat and scar tissue. They are not dangerous. Also, idiopathic granulomatous mastitis or sarcoidosis. These are diseases that can affect breast, and you can see some granulomas. These are nodules with immune system involvement. These are not dangerous also. So you can see there are quite a lot of different options you can find in their breast. Most of them are benign, many of them are not dangerous, most are fibroadenomas and cysts of breast. That's why if you find something, don't write the wheel. There are a lot of other options that are statistically more likely. That's all for today. Good luck, God bless you, goodbye.